Since 1869, New York City has operated a cemetery system designed to function through systematic invisibility. Hart Island, located in the Bronx's Long Island Sound, serves as the final destination for approximately 1,200 bodies annually, individuals whose deaths conclude without sufficient social or economic capital to secure private burial. The facility processes these remains through standardized trenches, each accommodating 150 adult bodies stacked 3 deep in documented arrangements that facilitate potential disinterment. Department of Correction personnel manage all operations, restricting public access and requiring advance permission for family visits. The system operates exactly as intended, efficiently, quietly, and largely unknown to the 8 million residents, whose municipal taxes fund its operation. No component malfunctions. Administrative protocols function correctly. Bodies receive proper documentation and careful placement. The ferry transports workers and materials on schedule. Yet this operational success creates a fundamental contradiction. A cemetery that must remain invisible to function cannot simultaneously serve the social purpose of memorialization that defines burial in American culture. Hart Island demonstrates how institutional design assumptions can create outcomes that contradict stated purposes. The facility was designed to solve a logistical problem, disposal of unclaimed remains, while avoiding the political problem of public awareness about mass burial within city limits. This design requirement shaped every subsequent decision: location selection, access restrictions, administrative terminology, and operational procedures. How can a municipal service succeed operationally while failing the fundamental social function it ostensibly serves? New York City's approach to municipal burial represents a century-and-a-half experiment in administrative invisibility. When city officials purchased Hart Island in 1868 for $75,000, they established more than a cemetery. They created an institutional mechanism designed to process death while avoiding public accountability for how that processing occurs. The island's selection reflected a fundamental design philosophy: geographic isolation would enable operational efficiency, while minimizing political scrutiny. This founding assumption shaped every subsequent administrative decision, creating a self-reinforcing system of concealment that operates independently of the moral intentions of individual administrators. The Hart Island system emerged from a specific municipal challenge: what to do with bodies that exceed the capacity of private funeral arrangements. Unlike traditional cemeteries, which operate as commercial enterprises serving paying customers, Hart Island functions as a municipal utility, processing remains that cannot generate revenue. This economic structure necessitated different design priorities. Where private cemeteries emphasize memorialization and family access to attract customers, Hart Island prioritized cost efficiency and administrative simplicity. The Department of Correction assumed operational control not because corrections expertise aligned with cemetery management, but because the department already operated facilities requiring isolation, security protocols, and minimal public interaction. The instrumentation of Hart Island's bureaucracy reflects this design logic. Official terminology systematically obscures rather than clarifies the nature of operations. Public burial denotes not public access but public funding. City cemetery appears on death certificates as a bureaucratic designation rather than a geographical location most residents could identify. The administrative database maintains burial records with methodical precision, while providing no mechanism for families to understand where their relatives are actually interred. This linguistic architecture functions as designed. It satisfies legal requirements for record-keeping while preventing public comprehension of the system's scale and nature. Hart Island's physical design reinforces administrative invisibility through geographical isolation. Located in Long Island Sound, accessible only by Department of Correction ferry from City Island in the Bronx, the facility requires multiple transportation transfers that effectively deter casual visits. The island itself contains no permanent civilian population, no commercial establishments, and no infrastructure designed for public access. Visitors must navigate security protocols identical to those governing prison visits: advance approval, government identification, electronic device surrender, and constant escort by corrections officers. This access structure ensures that Hart Island remains experientially abstract for most New Yorkers, known primarily through administrative categories rather than physical encounter. The burial methodology employed on Hart Island demonstrates how operational efficiency can systematically undermine social functions typically associated with death care. Bodies arrive in simple pine boxes, transported by truck and ferry, processed through trenches excavated by mechanical equipment. Each trench accommodates 150 adult bodies or 1,000 infant remains, stacked in documented arrangements that facilitate potential future disinterment. No individual grave markers identify specific remains. No ceremony marks individual burials. No designated space accommodates family observance. The process optimizes for throughput rather than memorialization, treating death as a logistical challenge rather than a social transition requiring ritual acknowledgement. This operational design reflects embedded assumptions about the social value of those buried on Hart Island. The system presupposes that individuals requiring municipal burial lack families capable of providing alternative arrangements, or that such families should not expect accommodation of traditional mourning practices. These assumptions become self-fulfilling. Families who might prefer private burial but cannot afford it find themselves categorized as having consented to public burial when no genuine alternatives exist. The administrative framework transforms economic constraint into apparent choice, enabling the system to process non-consensual burials while maintaining bureaucratic legitimacy. The Department of Corrections' role in Hart Island operations introduces additional design complications. Corrections officers supervise cemetery operations not because of relevant expertise in burial practices or grief counseling, but because the department already possessed infrastructure for managing isolated facilities with restricted access. This administrative convenience created procedural dependencies that shaped family interactions with Hart Island. Visiting procedures mirror prison protocols because the same personnel and security systems govern both functions. The emphasis on control and surveillance, appropriate for corrections facilities, becomes inappropriate when applied to bereaved families seeking to honor deceased relatives. Hart Island's design also reflects assumptions about the relationship between municipal services and public awareness. The system operates on the premise that effective municipal burial requires minimal public engagement. Unlike other municipal services that seek to demonstrate value to tax-paying residents, Hart Island's administrative logic demands the opposite. Successful operation requires that most residents remain unaware of the service's existence or scope. This creates a unique dynamic where publicity represents system failure rather than accountability. Media attention threatens operational efficiency by potentially increasing public demand for access, transparency, or alternative arrangements that would compromise cost control. The economic structure underlying Hart Island operations reinforces these design priorities. Municipal burial receives funding as a necessary but minimal public service, allocated to meet legal obligations rather than social expectations. This funding model incentivizes operational invisibility. The less public awareness of Hart Island's operations, the less political pressure for expensive improvements to facilities, access procedures, or burial practices. The system's success is measured by its capacity to process remains without generating public controversy, rather than by its effectiveness in serving bereaved families or honoring the deceased. These design assumptions created latent vulnerabilities that become apparent during periods of increased demand or public attention. The system optimizes for normal operational loads of approximately 1,200 burials annually, but provides minimal surge capacity for periods of elevated mortality. Administrative procedures assume that most families lack both the knowledge and resources to challenge burial arrangements, making the system vulnerable to organized advocacy efforts that increase public awareness. Geographic isolation protects the facility from casual scrutiny, but makes it difficult to accommodate legitimate family visitation needs without major procedural modifications. The Hart Island system represents institutional design choices that prioritize administrative efficiency over social function, creating a municipal service that succeeds operationally while failing to meet the community needs it ostensibly serves. These design premises embedded assumptions about social value, family capacity, and public accountability that shaped subsequent operational decisions, creating a self-reinforcing cycle of invisibility and exclusion. How did these foundational design assumptions create conditions where systematic denial of traditional death rights could operate as normal municipal procedure for over 150 years? The Hart Island system developed operational vulnerabilities through administrative practices that appeared rational within their immediate context, but created systematic barriers to family access and public oversight. These latent conditions emerged not from deliberate malice, but from the compound effect of bureaucratic optimization decisions that prioritized institutional efficiency over social accountability. By 2019, when Local Law 214 mandated the public hearing on Hart Island's future, the accumulated effect of these practices had created a municipal service that functioned opposite to its stated purpose of providing dignified burial for the city's most vulnerable residents. The Department of Corrections administrative procedures reflected training and organizational culture designed for managing incarcerated populations rather than serving bereaved families. Corrections officers applied security protocols appropriate for controlling potentially hostile individuals to families seeking to visit deceased relatives. Visitors underwent searches consistent with prison security rather than cemetery access. Electronic devices required surrender not because of cemetery operations needs, but because existing corrections protocols prohibited such devices in secure facilities. These procedures created psychological barriers that effectively discouraged family visits, transforming Hart Island from a cemetery with restricted access into a corrections facility that happened to contain burials. The visiting system established in the 2010s demonstrated how seemingly accommodating policies could function as access barriers when implemented through corrections-based procedures. Monthly gazebo visits, available to any member of the public, provided no mechanism for families to locate or visit specific burial sites. Gravesite visits, limited to documented family members, required advanced scheduling through the same administrative systems used for prison visits. The 12-business-day advance notice requirement exceeded the notice periods required for most other municipal services, effectively preventing spontaneous visits that characterize normal cemetery use. Families who failed to understand these procedural requirements faced automatic denial of access, with no appeal mechanism or alternative scheduling options. Documentation requirements for gravesite visits reflected assumptions about family structure and bureaucratic capacity that systematically excluded many Hart Island families. The Department of Correction required visitors to demonstrate family relationships through documentation but provided no guidance about what documentation would prove sufficient. Families lacking formal marriage certificates, birth certificates, or legal guardianship papers found themselves unable to establish eligibility for visits. This requirement particularly affected families from communities with informal relationship structures, undocumented immigrants afraid to provide identification documents, and families affected by bureaucratic disruptions during medical emergencies that led to Hart Island burial. The liability waiver requirement illustrated how risk management priorities designed for corrections facilities became inappropriate barriers when applied to cemetery visits. Families visiting Hart Island faced legal language typically associated with dangerous activities rather than cemetery visitation. The waiver's emphasis on potential injury and institutional liability protection reflected Department of Correction legal concerns rather than actual safety risks associated with cemetery visits. This documentation requirement created additional psychological barriers for families already traumatized by loss and unfamiliar with bureaucratic procedures required for Hart Island access. Record-keeping practices at Hart Island reflected the fundamental tension between the administrative need for accountability and the operational requirement for invisibility. The department maintained detailed burial records that satisfied legal requirements while providing insufficient information for families to understand burial locations or access procedures. Database entries included precise burial coordinates and detailed documentation of remains transfer procedures, but this information remained accessible only to department personnel rather than family members seeking to locate relatives. The searchable database introduced in the 2010s provided basic identification information, but omitted the contextual details that would enable families to navigate visitation procedures or understand burial arrangements. The administrative terminology used in Hart Island communications systematically obscured, rather than clarified operational realities, for families unfamiliar with municipal burial procedures. Public burial suggested government-provided funeral services rather than municipal disposal of unclaimed remains. City cemetery implied a municipal cemetery comparable to other public facilities rather than an isolated corrections-operated burial ground. Gravesite visits suggested individual grave access rather than approximate location visits to unmarked trench areas. This linguistic confusion was not deliberately deceptive, but reflected administrative language developed for bureaucratic, rather than public communication needs. Training protocols for Department of Correction personnel assigned to Hart Island reflected corrections rather than cemetery management priorities. Officers received training in security procedures, crowd control, and facility access restrictions, but little preparation for interacting with grieving families or explaining burial procedures. The department's organizational culture emphasized rule enforcement and risk minimization rather than customer service or community engagement. This training gap created interactions where corrections officers applied institutional control measures to families seeking information about deceased relatives, generating conflicts that reinforced public perception of Hart Island as an unwelcoming facility. The ferry schedule and transportation logistics demonstrated how operational efficiency measures could function as effective access barriers for families lacking flexible work schedules or private transportation. Ferry service operated according to corrections facility needs rather than family convenience, with limited departure times and no accommodation for visitors requiring public transportation connections. The requirement to depart from City Island, accessible only through the Bronx and requiring multiple public transportation transfers from most of New York City, effectively limited Hart Island access to visitors with private vehicles and flexible schedules. These transportation barriers disproportionately affected the same low-income populations most likely to require Hart Island burial services. Emergency procedures at Hart Island reflected corrections protocols inappropriate for cemetery operations. Medical emergencies during family visits triggered lockdown procedures designed for corrections facilities, rather than standard cemetery emergency responses. Communications systems prioritized institutional security, rather than family notification or coordination with external emergency services. These protocols reflected training and equipment designed for managing security threats rather than providing assistance during family medical emergencies, creating procedural responses that prioritized facility control over visitor safety. The absence of grief counseling or family support services at Hart Island reflected the Department of Corrections' organizational mission and training, rather than deliberate insensitivity to family needs. Corrections personnel lacked training in grief counseling, bereavement support, or community social services that would enable appropriate responses to family emotional needs during cemetery visits. The department's institutional culture emphasized emotional detachment and rule enforcement, rather than empathetic engagement, creating interactions where families experienced additional trauma rather than support during already difficult circumstances. Information management practices at Hart Island reflected competing requirements for public transparency and operational security that created systematic barriers to family access. The department maintained detailed records to satisfy legal accountability requirements, but restricted information access to prevent security breaches appropriate for corrections facilities. This resulted in extensive documentation of Hart Island operations that remained effectively inaccessible to families seeking basic information about burial arrangements. Requests for information triggered administrative procedures designed for freedom of information compliance rather than customer service, creating delays and bureaucratic complexity that discouraged family engagement. Maintenance and infrastructure decisions at Hart Island reflected corrections facility priorities rather than cemetery operations needs. Buildings and grounds received maintenance sufficient to meet security and operational requirements but inadequate for providing dignified family visitation experiences. The gazebo constructed for family visits reflected minimum compliance with visitation requirements, rather than thoughtful design for grief and remembrance activities. Infrastructure investment prioritized operational efficiency and security, rather than accessibility or family comfort, reinforcing Hart Island's institutional character rather than its cemetery function. These latent conditions created a self-reinforcing system where administrative efficiency measures systematically undermined the social functions typically associated with cemetery operations. Families encountered procedural barriers that discouraged engagement, while Department of Correction personnel operated within organizational cultures and training frameworks inappropriate for serving bereaved families. The cumulative effect transformed Hart Island from a municipal cemetery with access restrictions into a corrections facility that happened to contain burials, making family engagement sufficiently difficult that most relatives abandoned attempts to maintain connections with deceased family members. The interaction between these administrative practices and family characteristics created predictable patterns of exclusion that particularly affected the communities most likely to require Hart Island burial services. Low-income families lacked the bureaucratic sophistication to navigate complex access procedures. Immigrant families feared interactions with government agencies. Families affected by mental health issues, substance abuse, or housing instability found bureaucratic requirements insurmountable during crisis periods. These systematic barriers ensured that Hart Island's primary function became disposal of unclaimed remains rather than provision of municipal cemetery services. What administrative mechanisms enabled a municipal cemetery to function effectively as a family exclusion system while maintaining bureaucratic legitimacy through formal compliance with legal requirements? The COVID-19 pandemic's arrival in New York City during March 2020 created the precise conditions under which Hart Island's latent vulnerabilities would manifest as systematic failure. The pandemic functioned as an initiating event, not because it introduced new problems to the Hart Island system, but because it amplified existing contradictions to a scale that could no longer remain invisible to public scrutiny. What emerged was not a crisis of overwhelming mortality, but a revelation of how the system had always operated, efficiently processing death while systematically denying the social recognition that defines burial in American culture. On March 11, 2020, the World Health Organization declared COVID-19 a global pandemic. By March 22, New York State had implemented stay-at-home orders. The city's death rate, which typically averaged 150 to 200 daily deaths, began climbing exponentially. By early April, daily deaths exceeded 800, creating logistical challenges that exposed every design assumption underlying Hart Island's operations. The Office of the Chief Medical Examiner, responsible for determining whether remains would transfer to families or to the Department of Correction for Hart Island burial, faced processing delays that revealed how the normal flow of administrative decisions actually functioned. Under normal operations, remains transferred to Hart Island after families failed to claim them within specified time periods or demonstrated inability to arrange private burial. The pandemic disrupted this administrative sequence by creating simultaneous pressures, increased death rates, family inability to arrange traditional funerals due to social distancing restrictions, and economic disruptions that eliminated many families' capacity to fund private burial arrangements. What appeared to be an exceptional crisis was actually an acceleration of Hart Island's normal intake process, revealing how economic constraints had always driven municipal burial decisions. The Department of Corrections' response to increased burial demands demonstrated how efficiency measures could maintain operational capacity while undermining the social functions that distinguish cemetery operations from waste disposal. The department increased Hart Island burial frequency from weekly to daily operations, expanded trench capacity, and modified transportation logistics to accommodate higher volumes. These adaptations succeeded in processing increased mortality without creating backlogs or storage crises, proving the system's operational effectiveness. However, the visual documentation of these operations revealed burial practices that shocked New Yorkers who had never observed Hart Island's normal procedures. Drone footage released on April 2, 2020, by the Hart Island Project, showed workers in hazmat suits stacking wooden caskets in trenches, while heavy machinery prepared adjacent burial areas. Mainstream media coverage followed on April 9, creating the first widespread public visibility of Hart Island operations in decades. The images appeared extraordinary to viewers unfamiliar with Hart Island's standard procedures but represented routine operations scaled to meet increased demand. The public reaction revealed not crisis conditions but normal operations that had remained hidden from public awareness through geographic isolation and administrative obscurity. Mayor Bill de Blasio's response to the footage demonstrated how political leadership conceptualized Hart Island's function during crisis conditions. His April 9 statement that there will be no mass burials on Hart Island, and assurance that burials would proceed with every measure of dignity and respect, revealed the fundamental contradiction at the system's core. The mayor's statements treated Hart Island's established burial practices as emergency measures rather than normal operations, suggesting that municipal leadership had also internalized the fiction that Hart Island's operations resembled conventional cemetery practices. The shift from inmate labor to contracted workers, accelerated during April 2020, illustrated how operational changes could maintain efficiency while eliminating the most visible symbols of Hart Island's institutional character. COVID-19 outbreaks at Rikers Island created workforce shortages for Hart Island operations, forcing the Department of Correction to contract private burial services for the first time since 1869. This change removed the symbolically troubling image of incarcerated individuals burying the unclaimed dead, but maintained identical burial practices and access restrictions that had always characterized Hart Island operations. Medical examiner procedures during the pandemic revealed how administrative categories determined burial destinations rather than family preferences or deceased person's social circumstances. The Office of the Chief Medical Examiner classified remains as unclaimed when families could not arrange private burial within shortened time periods, but these classifications reflected administrative processing capacity rather than family abandonment. Many families actively sought to prevent Hart Island burial, but lacked resources to arrange alternatives within compressed decision timelines created by morgue capacity limitations. The pandemic exposed how Hart Island's intake procedures actually functioned by accelerating normal administrative processes to visible speed. Families who might ordinarily have weeks to arrange private burial faced decisions within days due to morgue space limitations. This acceleration revealed that many Hart Island burials resulted not from family abandonment but from bureaucratic processing timelines that exceeded family capacity to navigate private burial arrangements. The crisis made visible what had always been true. Hart Island served as the default destination for individuals whose deaths occurred without sufficient economic resources or bureaucratic sophistication to arrange alternatives. Hospital discharge procedures during the pandemic revealed additional systemic pressures that channeled remains toward Hart Island regardless of family preferences. Hospitals facing capacity crises prioritized rapid processing of deceased patients, shortening the time periods typically available for family decision-making about burial arrangements. Social distancing requirements eliminated traditional family consultation processes that might ordinarily enable collective resource pooling for private burial costs. These disruptions meant that families with marginal economic resources found themselves unable to arrange private burial, even when they actively sought alternatives to Hart Island. The increased burial grant program, announced during the pandemic, demonstrated how the municipal government understood Hart Island's function within the broader death care system. The city increased burial assistance from $900 to $1,700, acknowledging that inadequate financial support had driven families toward Hart Island burial against their preferences. However, the grant amount remained insufficient to cover average private burial costs, exceeding $10,000. And application procedures required bureaucratic navigation capacity that many affected families lacked during crisis periods. The program's limited success, 476 approved applications from 3,549 requests, revealed how administrative barriers could maintain Hart Island intake levels even when financial assistance became available. Public health measures during the pandemic eliminated many of the ceremonial and social functions that ordinarily accompanied death, making Hart Island's absence of ritual less conspicuous than under normal circumstances. Social distancing requirements prevented traditional funeral gatherings, making Hart Island's prohibition on ceremony consistent with broader public health restrictions. This temporary alignment between Hart Island practices and general social conditions reduced the apparent contrast between municipal and private burial options, making Hart Island's deficiencies less visible than they would have appeared under normal social conditions. The Department of Corrections communication strategy during the pandemic revealed how institutional language functioned to minimize public understanding of Hart Island operations. Press releases emphasized temporary increases in burial frequency and workforce changes while avoiding descriptions of burial practices that might generate public controversy. Official statements characterized Hart Island operations as dignified emergency responses rather than accelerated versions of routine procedures. This messaging strategy maintained administrative legitimacy while preventing public comprehension of how Hart Island operations actually functioned. The pandemic's effect on Hart Island families demonstrated how crisis conditions could simultaneously increase the need for cemetery access, while making such access more difficult to obtain. Families who had never experienced death in their households faced Hart Island burial procedures during periods of social isolation, economic disruption, and limited access to support systems. These circumstances created traumatic experiences for families unprepared for Hart Island's bureaucratic requirements and access restrictions, generating emotional distress that extended beyond grief over loss of family members. Documentation of Hart Island operations during the pandemic created the first comprehensive visual record of burial practices that had operated without external oversight for decades. Media attention forced temporary improvements in family notification procedures and access arrangements, but these modifications represented responses to publicity rather than systematic recognition of operational deficiencies. The temporary nature of these improvements suggested that increased transparency created political pressures incompatible with Hart Island's normal operational requirements. The pandemic revealed that Hart Island's function as a municipal cemetery had always been secondary to its primary purpose as an administrative solution to the political problem of visible destitution. When crisis conditions made Hart Island operations visible to general public scrutiny, the system's operational success became politically problematic, requiring emergency communication strategies and procedural modifications to maintain municipal legitimacy. How did crisis conditions reveal that Hart Island's systematic exclusion of families represented normal operations rather than emergency procedures? And why did this revelation require immediate political management rather than operational adjustment? The systematic breakdown of Hart Island's social function during the COVID-19 pandemic followed a predictable sequence that revealed how administrative efficiency could achieve operational success while creating complete failure of public service delivery. The failure chain began not with pandemic conditions but with design assumptions that prioritized institutional protection over community accountability. Each step in the sequence represented logical responses to immediate pressures that collectively produced outcomes contradicting the system's stated purpose of providing dignified municipal burial services. The initial link in this failure chain operated through the medical examiner's classification system, which determined whether deceased individuals would transfer to family custody or Department of Correction control based on administrative processing timelines rather than actual family circumstances. Under normal conditions, the Office of the Chief Medical Examiner held remains for family claim periods that reflected morgue capacity rather than family needs. During the pandemic, reduced holding periods compressed family decision-making windows from weeks to days, automatically increasing the number of individuals classified as unclaimed regardless of family efforts to arrange private burial. This classification process created a feedback loop where administrative efficiency measures generated increased Hart Island intake, which justified expanded burial operations that further reduced per-case processing time. The Office of the Chief Medical Examiner faced genuine capacity constraints during peak mortality periods, making reduced holding times operationally necessary. However, these administratively rational decisions transformed families with limited resources from potential private burial customers into automatic Hart Island recipients, regardless of their preferences or efforts to arrange alternatives. The Department of Corrections' response to increased burial demands demonstrated how operational scaling could maintain system function while amplifying its fundamental contradictions. The department's logistical capabilities proved adequate to process increased volumes through expanded trench operations, increased ferry scheduling, and workforce modifications that maintained burial capacity without creating storage backlogs. These adaptations succeeded in preventing the public health crisis that would have resulted from inadequate body disposal capacity, proving the system's effectiveness at its primary administrative function. However, scaling operations revealed practices that had remained hidden during normal operational volumes. The mechanical efficiency required to process increased burial loads eliminated the minimal ceremonial accommodations that had previously obscured Hart Island's institutional character. Workers processed caskets through trenches using forklift equipment designed for cargo handling rather than ceremonial burial. The visual appearance of these operations, when documented through drone footage, revealed Hart Island's function as an industrial disposal system rather than a cemetery providing burial services. The workforce transition from inmate labor to contracted services, accelerated by COVID-19 outbreaks at Rikers Island, demonstrated how operational modifications could eliminate symbolic problems while maintaining procedural deficiencies. The use of incarcerated individuals for burial labor had created particularly troubling symbolism, the disenfranchised burying the forgotten, that generated criticism even among observers who accepted Hart Island's basic operational model. Contracted workers eliminated this symbolic issue while maintaining identical burial practices, access restrictions, and family exclusion procedures that had always characterized Hart Island operations. This workforce change revealed how Hart Island's most visible problems functioned as distractions from more fundamental structural issues. Public attention focused on the inappropriate symbolism of prisoner labor rather than the systematic denial of family participation in burial processes. The transition to contracted labor satisfied critics concerned with prisoner exploitation, while preserving all administrative practices that prevented Hart Island from functioning as an accessible municipal cemetery. The burial grant program expansion during the pandemic created an apparent alternative to Hart Island burial while maintaining administrative barriers that preserved the system's intake levels. The increase from $900 to $1,700 in burial assistance appeared to address economic factors that drove families toward Hart Island, but the grant amount remained insufficient to cover private burial costs, and application procedures required bureaucratic navigation beyond the capacity of many affected families. The program structure demonstrated how apparent reforms could maintain legitimacy without affecting operational outcomes. Processing statistics from the burial grant program revealed the systematic nature of administrative barriers that channeled families toward Hart Island regardless of available alternatives. Of 3,549 applications submitted during the pandemic period, only 476 received approval, a 13.4% success rate that reflected procedural complexity rather than genuine resource constraints. Two-thirds of denials resulted from missing paperwork rather than ineligibility, indicating that administrative requirements functioned as effective barriers even when financial assistance became available. The remaining applicants abandoned the process entirely, demonstrating how bureaucratic complexity could deter families from accessing alternatives to Hart Island burial. The physical evidence from Hart Island operations during the pandemic documented burial practices that contradicted official characterizations of municipal cemetery services. Aerial footage showed systematic stacking of caskets in industrial trenches using mechanical equipment, with no accommodation for individual grave markers, family identification of burial locations, or ceremonial recognition of deceased individuals. The burial process resembled warehouse storage procedures rather than cemetery interment, revealing how efficiency optimization had eliminated the social recognition functions that distinguish burial from disposal. Documentation requirements imposed during the pandemic revealed how privacy protection measures could function as additional barriers to family access, while appearing to serve legitimate administrative purposes. The Department of Correction removed maternal names from public burial records for fetal remains, citing privacy concerns while maintaining these records in internal databases accessible only through individual requests. This policy created an additional administrative layer that families had to navigate to locate deceased relatives, while providing no actual privacy protection, since families seeking access possessed knowledge of their own medical histories. The ferry scheduling and transportation modifications during the pandemic demonstrated how operational adjustments could maintain efficiency while reinforcing family exclusion. The Department of Correction reduced ferry service frequency to minimize COVID-19 exposure risks, while maintaining sufficient capacity for burial operations and essential personnel transport. These schedule changes eliminated most opportunities for family visits, while preserving all functions necessary for continued burial operations, revealing how family access had always been peripheral to Hart Island's operational requirements. Communication strategies employed during the pandemic showed how institutional messaging could maintain administrative legitimacy while preventing public understanding of operational realities. Department of Correction press releases emphasized temporary workforce changes and emergency procedures, while avoiding detailed descriptions of burial practices that had operated unchanged for decades. Official statements characterized increased burial frequency as pandemic response measures, rather than scaling of routine operations, maintaining the fiction that Hart Island's visible deficiencies represented temporary crisis conditions rather than normal operational characteristics. The legislative response to pandemic conditions at Hart Island demonstrated how political interventions could address symbolic issues while preserving structural problems. New York City Council legislation transferring Hart Island from Department of Correction to Department of Parks jurisdiction eliminated corrections oversight while maintaining geographic isolation, access restrictions, and administrative procedures that had always prevented Hart Island from functioning as a conventional municipal cemetery. This jurisdictional transfer satisfied demands for institutional change while preserving operational characteristics that serve municipal administrative needs. The physical infrastructure modifications implemented during the pandemic revealed how minimal investments could create appearances of improvement while maintaining fundamental access barriers. The Department of Correction constructed additional visitor facilities and improved transportation logistics, but these enhancements operated within the same geographic and procedural constraints that had always limited family access. Improved facilities provided better experiences for the small number of families who successfully navigated access procedures, while leaving unchanged the administrative barriers that prevented most families from accessing Hart Island at all. The cumulative effect of these operational responses created a system that functioned more efficiently during crisis conditions, while becoming more obviously contradictory in its social function. Hart Island demonstrated remarkable capacity to scale burial operations while maintaining cost control and preventing public health emergencies. However, this operational success occurred through intensification of practices that eliminated any resemblance to conventional cemetery services, creating a municipal facility that succeeded as a disposal system, while failing completely as a burial service provider. The failure chain revealed that Hart Island's apparent crisis during COVID-19 represented not system breakdown, but system revelation, the first time in decades that Hart Island's normal operations became visible to general public scrutiny. The shock experienced by New Yorkers reflected not emergency conditions but recognition of how municipal burial had always functioned, hidden from public awareness through geographic isolation and administrative obscurity. How did operational scaling during crisis conditions reveal that Hart Island's efficiency depended on systematic elimination of the social recognition that defines burial? And why did this revelation require immediate political management rather than operational reform? The municipal government's response to public scrutiny of Hart Island operations during COVID-19 demonstrated how institutional stabilization efforts could address symbolic concerns while preserving the administrative structures that had created systematic family exclusion. These stabilization attempts succeeded in reducing immediate political pressure without resolving the fundamental contradictions that had made Hart Island operations shocking when revealed to public awareness. Each reform measure created appearances of improvement while maintaining the geographic isolation, administrative complexity, and institutional priorities that prevented Hart Island from functioning as an accessible municipal cemetery. The Department of Corrections' immediate response to media coverage focused on communication management rather than operational modification, revealing how the agency understood the primary threat as public relations rather than service delivery failure. Press statements emphasized the dignity and respect accorded to Hart Island burials while avoiding detailed descriptions of burial practices that had generated public concern. Official communications characterized increased burial frequency and workforce changes as temporary pandemic measures rather than scaling of established procedures, maintaining administrative legitimacy by treating visible operations as exceptional rather than routine. This communication strategy succeeded in containing immediate political damage while preserving operational autonomy that enabled continued processing of increased burial volumes without procedural modifications that would have reduced efficiency or increased costs. The Department of Correction maintained burial capacity sufficient to prevent public health emergencies while implementing minimal changes to access procedures or family notification systems. These priorities demonstrated how institutional stabilization focused on maintaining operational capacity, rather than addressing community service deficiencies. The workforce transition from inmate labor to contracted services represented the most visible stabilization measure, eliminating the symbolically problematic image of incarcerated individuals conducting burials while maintaining identical practices for family exclusion and ceremonial denial. Contracted workers performed burial operations using the same mechanical equipment, trench systems, and processing procedures that had operated under inmate labor, preserving all operational characteristics that distinguished Hart Island from conventional cemeteries. This change satisfied critics focused on prisoner exploitation while leaving unchanged the administrative barriers and geographic isolation that prevented family participation in burial processes. The transition revealed how stabilization efforts could eliminate symbolic problems while preserving structural deficiencies that created service delivery failures. Public attention concentrated on the inappropriate symbolism of prisoner labor rather than the systematic denial of family access, ceremonial accommodation, or individual grave recognition that characterized all Hart Island operations regardless of workforce composition. Contracted labor satisfied demands for reform while maintaining the efficiency optimization and cost control that required elimination of traditional cemetery services. Legislative intervention through New York City Council represented the most comprehensive stabilization attempt, transferring Hart Island jurisdiction from the Department of Correction to the Department of Parks and Recreation, while maintaining geographic isolation and access restrictions that had always limited family engagement. This jurisdictional transfer addressed institutional culture concerns by removing corrections oversight while preserving operational characteristics that served municipal administrative needs. The legislation created appearances of fundamental reform while maintaining the remote location and controlled access that enabled Hart Island to function as an invisible disposal system. The transfer to Parks Department jurisdiction illustrated how institutional reorganization could satisfy demands for change while preserving the geographic and procedural constraints that prevented Hart Island from operating as a conventional municipal cemetery. Parks Department management eliminated corrections protocols inappropriate for cemetery operations but maintained the ferry access, advanced scheduling requirements, and visitor limitations that had always restricted family engagement. This reform addressed the most visible institutional problems while preserving the isolation and control mechanisms that enabled efficient municipal burial operations without public accountability. The implementation timeline for jurisdictional transfer revealed competing priorities between immediate political pressure and long-term operational requirements. The legislation specified July 2021 implementation but provided no funding for infrastructure modifications, staff training, or procedural development that would enable Parks Department personnel to operate cemetery services rather than disposal operations. This timeline reflected political needs for immediate reform announcements, while acknowledging administrative realities that required continued Department of Correction involvement until alternative operational capacity could be developed. Visitor access modifications implemented during the stabilization period demonstrated how apparent improvements could maintain fundamental barriers while creating positive publicity about increased family accommodation. The Department of Correction, expanded from monthly to twice-monthly gravesite visits, and increased capacity from 25 to 35 visitors per session, addressing the most visible access limitations while preserving advanced scheduling requirements and geographic isolation that prevented spontaneous visits. These modifications satisfied families who successfully navigated access procedures while leaving unchanged the administrative complexity that deterred most potential visitors. The visiting procedure improvements revealed how incremental reforms could create meaningful benefits for families with sufficient resources and persistence to access Hart Island while maintaining systemic barriers that excluded most potential users. Enhanced ferry scheduling and improved visitor facilities provided better experiences for families who completed advance registration procedures, possessed required documentation, and could arrange transportation to City Island. However, these improvements operated within the same geographic and administrative constraints that had always limited Hart Island access to a small subset of affected families. Database and information access improvements during the stabilization period illustrated how transparency measures could provide technical compliance with public accountability requirements while maintaining practical barriers to family engagement. The Department of Correction enhanced the online database search functions and improved record accessibility, enabling families to locate deceased relatives more easily while preserving procedural complexity that made visitation difficult to arrange. These technical improvements satisfied demands for transparency while maintaining the administrative burden that discouraged family pursuit of Hart Island access. The expanded burial grant program represented the most substantial attempt to provide alternatives to Hart Island burial, acknowledging economic factors that channeled families toward municipal burial against their preferences. The increase to $1,700 in financial assistance addressed inadequate funding that had made private burial impossible for families with marginal economic resources, but the grant amount remained insufficient to cover private burial costs, and application procedures required bureaucratic navigation that many families could not manage during grief periods. The program structure demonstrated how apparent solutions could maintain legitimacy without affecting operational outcomes. Processing outcomes from the burial grant program revealed how administrative barriers could preserve Hart Island intake levels even when financial assistance became available. The 13.4% approval rate reflected procedural complexity rather than resource limitations, with most denials resulting from incomplete documentation rather than ineligibility. These outcomes suggested that families who could not navigate private burial arrangements also lacked capacity to complete grant applications, maintaining the same demographic selection that had always characterized Hart Island operations. Secondary crisis management focused on privacy concerns raised by public availability of burial records that enabled identification of circumstances surrounding individual deaths. The Department of Corrections' decision to remove maternal names from fetal burial records addressed legitimate privacy concerns while creating additional administrative layers that complicated family efforts to locate deceased relatives. This policy modification demonstrated how legitimate administrative improvements could inadvertently reinforce barriers to family access while appearing to provide enhanced protection for sensitive information. The privacy policy modifications revealed competing demands between public accountability requirements that mandated record accessibility and family protection needs that required information restriction. The Department of Corrections' solution, maintaining detailed internal records while restricting public access, satisfied both requirements while creating additional procedural complexity that families had to navigate to access information about deceased relatives. This approach preserved administrative efficiency while adding bureaucratic layers that functioned as practical barriers to family engagement. Infrastructure assessment and improvement planning during the stabilization period demonstrated how long-term reform discussions could deflect immediate pressure for operational changes while preserving existing practices indefinitely. The 2019 public hearing process created extensive documentation of potential improvements, including building demolition, expanded burial capacity, and enhanced visitor facilities, but provided no implementation timeline or funding commitments that would require actual modifications to Hart Island operations. These planning discussions satisfied demands for comprehensive reform consideration while enabling continued operations under existing procedures. The infrastructure planning process revealed how genuine technical challenges could justify continued operations under deficient conditions while creating appearances of serious reform consideration. Assessments of building demolition, soil remediation, and capacity expansion identified legitimate engineering and environmental concerns that would require substantial investment and extensive planning periods before implementation. These technical requirements provided rational justification for maintaining current operations while suggesting that comprehensive improvements remained under active consideration. The cumulative effect of stabilization measures created a system that appeared more responsive to family needs while maintaining the fundamental characteristics that prevented Hart Island from functioning as an accessible municipal cemetery. Improved communication, enhanced visitor facilities, and jurisdictional transfer addressed the most visible problems while preserving geographic isolation, administrative complexity, and efficiency optimization that required systematic family exclusion. These reforms satisfied political demands for change while maintaining operational characteristics that served municipal administrative needs. The stabilization period revealed that Hart Island's problems could not be resolved through incremental improvements because its efficiency depended on characteristics incompatible with conventional cemetery operations. Geographic isolation enabled cost control but prevented family access. Administrative streamlining reduced operational costs but eliminated ceremonial accommodation. Efficiency optimization maintained political viability but required elimination of the social recognition functions that distinguish burial from disposal. How did stabilization efforts reveal that Hart Island's operational efficiency was fundamentally incompatible with providing cemetery services, and why did successful reforms require preservation of the characteristics that had made the system shocking when revealed to public scrutiny? The forensic examination of Hart Island's institutional structure during the COVID-19 revelation period provided comprehensive documentation of how a municipal service could operate successfully for 150 years while systematically failing to serve its stated community purpose. Physical evidence from Hart Island operations, legislative records from the 2019 public hearing process, and administrative documentation from pandemic response efforts revealed a system designed to solve political problems through geographic and administrative invisibility, rather than to provide cemetery services for municipal residents. The forensic analysis demonstrated that Hart Island's apparent failures represented successful operation according to its actual design specifications. Physical inspection of Hart Island facilities documented infrastructure designed for efficient body disposal rather than cemetery operations serving bereaved families. Burial trenches accommodated mechanical equipment optimized for cargo handling rather than ceremonial interment. The absence of individual grave markers, ceremonial spaces, or family accommodation areas reflected design priorities that eliminated features associated with conventional cemetery operations. Infrastructure investments had concentrated on operational efficiency, ferry docks, equipment storage, administrative buildings, while providing minimal facilities for family visits or memorial activities that characterized normal cemetery functions. The gazebo constructed for family visits exemplified infrastructure designed for minimal compliance with access requirements rather than meaningful accommodation of grief and remembrance activities. Located adjacent to the ferry dock rather than burial areas, the facility provided no visual or physical connection to deceased relatives, while satisfying legal requirements for family access. The structure's isolation from actual burial locations and its institutional appearance reinforced Hart Island's character as a corrections facility rather than a cemetery, demonstrating how apparent accommodations could satisfy bureaucratic requirements while discouraging family engagement. Archaeological evidence from Hart Island's historical operations revealed burial practices that had remained essentially unchanged since the facility's 1869 establishment, despite periodic public attention and reform efforts spanning multiple decades. Photographic documentation from the 1880s showed burial procedures recognizably similar to 2020 operations, with mechanical stacking of caskets in trenches using available industrial equipment. This consistency across 150 years of operation demonstrated that Hart Island's efficiency depended on practices incompatible with conventional cemetery operations making genuine reform impossible without eliminating the characteristics that enabled cost-effective municipal burial. Documentation from the 2019 public hearing process provided comprehensive evidence of how municipal officials understood Hart Island's function within the broader urban infrastructure. Testimony from city agencies revealed competing priorities between operational efficiency requirements and community service expectations that could not be reconciled through incremental reforms. The Human Resources Administration's establishment of the Office of Burial Services represented acknowledgement that Hart Island had never functioned as a cemetery service, but rather as an administrative solution to political problems created by visible destitution and unprocessed mortality. Legislative records from Local Law 214 revealed how policy interventions could mandate reform processes while preserving operational autonomy that enabled continued practices incompatible with stated reform objectives. The law required comprehensive planning for Hart Island's future while providing no funding, timeline, or enforcement mechanisms that would compel actual modifications to existing operations. This regulatory approach satisfied political demands for legislative action while enabling continued operations under existing procedures, demonstrating how apparent reform could function as a mechanism for preserving problematic practices. The 2019 public hearing testimony documented systematic contradictions between community needs and institutional capabilities that revealed why Hart Island could not function as a conventional municipal cemetery without fundamental restructuring. Families testified about bureaucratic barriers that prevented access to deceased relatives, while city agencies explained operational constraints that made family accommodation incompatible with efficiency requirements. These testimonies revealed that Hart Island's problems were not implementation failures, but design features that enabled the system to fulfill its actual purpose as an invisible disposal mechanism. Engineering assessments commissioned during the reform planning process provided technical documentation of infrastructure limitations that would prevent Hart Island from operating as an accessible public cemetery without investment levels incompatible with municipal budget priorities. Soil contamination from historical uses, building deterioration requiring complete reconstruction, and transportation infrastructure inadequate for public access created engineering constraints that justified continued restrictions on family engagement. These technical limitations provided rational justification for preserving existing operational characteristics while creating appearances of serious reform consideration. The fiscal analysis embedded in reform planning documents revealed how Hart Island's apparent cost-effectiveness depended on systematic elimination of services typically associated with cemetery operations. Per-burial costs remained below private cemetery rates because Hart Island eliminated individual grave markers, ceremonial accommodation, family consultation services, and memorial maintenance that constituted standard cemetery operations. This cost structure demonstrated that Hart Island's efficiency required practices that prevented it from providing cemetery services comparable to private alternatives, making reform impossible without accepting substantially increased municipal expenditures. Post-pandemic operational data documented how Hart Island's apparent crisis had actually demonstrated system resilience rather than failure. Burial processing rates scaled successfully to meet increased demand without creating public health emergencies, storage backlogs, or administrative breakdowns that would have threatened municipal operational capacity. The system's ability to absorb mortality increases of 300 to 400% above normal levels proved its effectiveness at primary administrative functions, while revealing that community service had never been a design priority. The workforce transition data from inmate labor to contracted services provided quantitative evidence of how symbolic reforms could maintain identical operational outcomes while satisfying political demands for institutional change. Processing times, burial practices, and family access restrictions remained unchanged after workforce transition, demonstrating that Hart Island's operational characteristics reflected administrative design rather than corrections culture. This evidence revealed how institutional modifications could address visible symbols of system problems while preserving structural features that created service delivery failures. Database analysis from the Enhanced Burial Record System documented how transparency improvements could provide technical compliance with accountability requirements while maintaining practical barriers to family engagement. Improved search functions enabled families to locate deceased relatives more easily, but accessing this information required navigating the same administrative procedures that had always limited Hart Island engagement. These improvements satisfied demands for transparency while preserving procedural complexity that discouraged family pursuit of cemetery access. The privacy policy modifications implemented during the reform period provided documentation of how legitimate administrative improvements could inadvertently reinforce systematic barriers to family access. Removing maternal names from public fetal burial records addressed genuine privacy concerns while creating additional bureaucratic layers that complicated family efforts to locate deceased relatives. These policies demonstrated how well-intentioned reforms could preserve the administrative burden that served Hart Island's primary function as an invisible disposal system. Economic analysis of the burial grant program provided quantitative evidence of how apparent alternatives to Hart Island burial could maintain intake levels while creating appearances of addressing economic factors that drove municipal burial decisions. The 13.4% approval rate for burial grants demonstrated that administrative barriers functioned more effectively than resource constraints in channeling families toward Hart Island, revealing how procedural complexity could preserve operational characteristics, even when financial alternatives became available. Long-term demographic analysis of Hart Island burials revealed systematic patterns of exclusion that particularly affected communities least capable of navigating bureaucratic procedures or challenging administrative decisions. Low-income families, immigrants, individuals with mental health or substance abuse issues, and socially isolated residents constituted disproportionate percentages of Hart Island burials, demonstrating how the system functioned as a mechanism for processing deaths that occurred without adequate social or economic resources rather than providing universal municipal cemetery services. The cumulative forensic evidence demonstrated that Hart Island had operated successfully according to its actual design specifications for 150 years, providing invisible disposal of municipal mortality while maintaining political legitimacy through formal compliance with legal requirements for burial services. The system's apparent failures represented successful achievement of administrative objectives that prioritized cost control and political invisibility over community service delivery, revealing how municipal infrastructure could serve institutional needs while systematically excluding the populations it ostensibly served. The forensic analysis revealed that Hart Island's reform would require acknowledging its actual function as an administrative solution to political problems, rather than a deficient cemetery service requiring improvement. Genuine reform would necessitate accepting either substantially increased municipal expenditures for accessible cemetery operations or explicit recognition that Hart Island served as a disposal system rather than a burial service, making transparent community decisions about municipal death care priorities rather than maintaining institutional fiction about Hart Island's cemetery function. The Hart Island system demonstrated how municipal services could operate efficiently for decades, while systematically excluding their intended beneficiaries. Using geographic isolation, administrative complexity, and institutional design to transform service delivery failures into operational successes that served political and budgetary priorities while maintaining democratic legitimacy through formal compliance with legal requirements that bore no relationship to actual community needs. What systemic features enabled Hart Island to function as a successful municipal disposal system while maintaining political legitimacy as a cemetery service? And why did forensic analysis reveal that reform would require explicit community decisions about municipal death care priorities rather than administrative improvements to existing operations?